Hi, this is Devin and Jess, and this is our project on shoulder impingement. First off, let's talk about what exactly shoulder impingement is. First, we will take you through the important structures involved in shoulder impingement syndrome. We're going to start at the very left with the supraspinatus tendon. This tendon is what is normally pinched within shoulder impingement syndrome. As you can see, it's running through what is known as the subacromial space, which is underneath the acromion of the scapula. The narrowing of the subacromial space is the most common cause of shoulder impingement syndrome. We are going to just briefly go through the anatomy of the shoulder joint. So we have three different bones that are associated with the shoulder joint. We have the scapula, which is all along here, and an important part of the scapula is the scapular spine, which runs along this red line here, and it ends in what's called the acromion process, and this is a very, very important structure in shoulder impingement syndrome. And then we have the humerus, which starts here and runs all the way, this bone right here, but the humerus head inserts into the shoulder joint socket right about here, and then we have the clavicle. The supraspinatus is the muscle that is most commonly associated with impingement in the shoulder impingement syndrome, and this is roughly where it runs in the body and it gets impinged underneath the acromion process. As you can see from this diagram, it's quite evident how the tendon of the supraspinatus could easily become impinged under the acromion if the humeral head were to move too far up within the shoulder socket. There are four important muscles that provide stabilization to the shoulder joint through keeping the head of the humerus in place with the glenoid fossa. These four muscles are the teres minor, the subscapularis, the infraspinatus, and the supraspinatus. These muscles are also known as the rotator cuff. As you can see from this diagram, this is an example of an inflamed supraspinatus tendon. The goals of rehab for impingement syndrome are going to be to correct muscle imbalances in order to move the humeral head down away from the acromion and to allow adequate room for the supraspinatus tendon to function. Here are some causes of shoulder impingement syndrome. Primary impingement is a result of congenital anomaly in the acromion configuration. Secondary impingement reduces the subacromial space because of alterations in the shoulder's function, which leads to instability within the shoulder joint. Causes are due to rotator cuff weakness, scapular rotator muscle imbalance, capsular laxity or tightness, and postural deviations. This is an X-ray of an individual who actually has shoulder impingement syndrome. Now we're going to take you through a rehabilitative program to help you alleviate the symptoms and hopefully open up that subacromial space and reduce impingement on your supraspinatus tendon. This particular rehab program is being started at the very end of proliferation phase.
The first exercise that we're going to do today for range of motion and flexibility is called the cross-body stretch. And this is aimed at really stretching out the posterior capsule of the shoulder joint, which is often really tight with people that have it. So what Jess is going to do, she's going to turn around. Yeah. So she's going to extend, I'm going to do it right there, actually, her right arm forward. Now the important thing about this, she's going to keep her shoulder down. She's not going to let her shoulder an effective stretch. She's going to move her arm across her body, and using the other arm to lock underneath it, she's going to again pull that arm closer to her body. Yeah, awesome. And notice how she just drops her shoulder again, and that's what we want to see. Now, if we have just raise her shoulder, see how that's not going to be a very effective stretch. Moving the stretch from the capsule down into her back, and that's not what we want. So, down again. Awesome.
Contraindications include recent fracture, bony block, an infection of the joint, acute inflammation of the joint, or extreme or sharp pain with motion.
For the strengthening exercise, what we're going to show you is an internal rotation for the subscapularis muscle. So what you're going to do is you're going to have your patient lie down on her back in a comfortable position. And what you're going to do for this exercise is one resistance band. But you're going to want the resistance band to be anchored at a pretty good distance from the patient in order to have a little bit of resistance in the band. So what we're going to do is the patient is going to raise her elbow at a 45-degree angle from her body with her wrist pointing backwards. You're going to have her grab the resistance band, and the whole time she's doing the exercise, we really want to make sure that her shoulder and her elbow stay in very close contact with the ground. So then what she's going to do is she's going to lift up her arm and then put her knuckle all the way to her wrist, and then she's going to slowly return to the starting position. And then she's going to do it again, knuckles to the wrist, keeping the shoulder and the elbow on the ground. Slow down, and then more to the knuckle. Contraindications of this exercise include anterior shoulder pain, reduced function from the previous day of the shoulder joint, a labral pathology, or anterior posterior glenohumeral joint instability.
For the last exercise that we're going to do today, we're going to be working with straightest anterior, which is going to help stabilize your sternum. This is really important for people that have shoulder pain. So, what I'm going to ask Jess to do is extend her arm up, back, so it's at 90 degrees with the rest of her body. Then I'm going to ask her to press her shoulder down, good job, and then flatten her. So what she's going to do is, it's a push up. So she's going to push her shoulder up, away from the mat, and then let it fall back down, without letting her shoulder come closer to her ear. So we want to keep that same distance the whole way down. Yeah, awesome. So, and it's going to be on the way up that she's going to be getting that serious anterior.
This exercise should be stopped if a patient feels any anterior shoulder pain. The contraindication to this exercise includes posterior glenohumeral joint instability and a labral pathology.
As you can probably notice, Jess is making a really common mistake that happens. What's happening is she's letting her shoulder come up towards her ear and then dropping her hand down. So what I'm going to have Jess do, just to kind of cue her and help her along, is I'm going to put my hand on her shoulder while she does the exercise to try and help her keep it down. Yeah. And keep it down. There we go. Does that feel different? For the next progression of this exercise, we're going to have Jess do the same motion, except she's going to be standing up and using a ball against the wall. So, what I'm going to have her do is I'm going to have her extend her arm right up horizontal with the ball between her hand and the wall. Now, again, it's going to be really important that she keeps her shoulder down. Now she's going to be able to move her hand in whatever pattern she wants. You can give her a pattern or have her make her own. I'm going to ask her to do circles and up and down. And notice how she's keeping her shoulder down while also keeping her shoulder pushed forward or protracting, which is what we want to see. It's going to feel similar to the patient as lifting their shoulder off the mat that we did in the last exercise.
Contraindications to this exercise are the same as previously shown in the last exercise.
The last exercise that we're going to have Jess do today is the functional progression. So what we're going to ask her to do is similar to the other motions, except we're going to add in some perturbations to really work on her proprioception. Okay, so what I'm going to have you do, Jess, is send your arm up. Yeah, good job. Again, keeping that shoulder down. And push forward protractor, just like she just did. So what I'm going to do now is I'm going to start adding perturbations or just lightly tapping Jess's forearm in different ways. So it's important to also tap on the end of the arm because it's going to be that motion of moving the humeral head away from the scapula that's going to be really working on the serratus anterior, which is what we want to see.
Contraindications are the same as previous serratus anterior exercises.
Good job. Yeah.
Which way do you want me to be?
Right there.
Here?
We'll start, yeah.
It's very important.
No, like in front of the camera.
Oh. Why is it important to do that? It is very...
Hey, whoa, Turbo. You're like dancing and you're like already talking. Okay, ready? One.
Whoopsies.
I don't know if that was right or not. I think. Kidding. Athletes. Oh. What am I talking about?